Alright, I wanted to do a little review of a calcium paper, and this paper was presented in class, and it's one that has a co-author of Louise Burke, and I think she's rather brilliant, so that's one reason to have included this study and focus on this study. But it's also it's in elite athletes. Two, they're doing an exercise that mimics training, and so it's on a ergometer, and it's a human trial, and so it's an acute study of calcium intake, or studying differences in calcium intake, and how the exercise, in this case rowing, which is, some may consider that lesser impact sport compared to running and things like that. The ground reaction forces, or at least with the feet, is different. So kind of without further ado, this table here is the characteristics of the subjects: height, weight, vitamin D status, a host of general things. You can kind of pause and review this as you deem appropriate, and you will anyway, which is good. The other aspect, if some of you are not familiar with human trials, I like this figure because it just depicts a day in the life of a scientist, or scientific team in this case, because I'm guessing this one person didn't do all of this, just a hunch. And if any of you that were a part of this study want to share about what was done, please feel free to do so. Anyway, in essence, you can see that it was almost 11 hours. In essence, I would guess that everybody was there for at least 12, and there would have been prep time for meals, setting things up beforehand. So 10 blood draws throughout the day, 2 meals here and here, snacks, and then a recovery meal, and then 2 exercise sessions. And just to kind of highlight, these are 90 minutes-ish. They have it at 100 because there was rest between, and there was likely a warm-up. I don't remember exactly how that went, but of exercise, hard work, 90 minutes, so that's twice a day, so 3 hours of exercise. So again, these are elite rowers. And all of the data that were collected throughout, and then recovery. And for the meals, there was a low calcium meal, high calcium meal, and then they did a good job of making it isocaloric. Protein was different, fat was about the same, so therefore if protein's different and fat's the same, carbohydrate's going to be different. However, calcium was, having a meal of 1 milligram of calcium with these foods is awesome to be able to accomplish. And so and then match it, having similar foods for the between the control and the high calcium meal. And so in essence, they were getting their theoretical RDA-ish amount in those high calcium meals over the course of the day. So where the differences were, they measured other aspects. They measured serum calcium and hematocrit. No difference once things were adjusted for. Again, the body does a really good job of kind of maintaining serum calcium and trying to control it and clamp it, in essence, in place. However, parathyroid hormone and The marker for bone turnover, the C-terminal telepeptide for collagen type 1. So both, you have control, oops, sorry, that's just take 2. You have control, calcium, and so the control calcium, and you see that throughout the trial. Significant differences between parathyroid hormone and the bone turnover marker were different between the conditions. I think this is a unique study just because most people, I don't think, would consider rowing eliciting a response on bone such as this, and maybe I'm not well versed with crew and rowing, so that could be an example of my ignorance in the sport with regard to bone and bone turnover. Not that I would expect them to have higher bone mineral density than other athletes who are doing less strenuous work. Nonetheless, regarding kind of calcium and bone turnover in one day of exercise, we can see that the markers of bone turnover and parathyroid hormone are significantly less, depending upon the time. It drops back down during rest, and then it separates again during exercise, and at recovery, they come back together. So the body is able to de-stress from the stress of exercise, and get homeostasis, get to a point of better homeostasis between conditions, I guess. And so their kind of conclusion, practical strategies may be integrated into the athlete's overall sports nutrition plan with the potential to safeguard long-term bone health and reduce risk of bone stress injuries. And so I do think this would translate well to other sports that may have even greater bone stresses. And so the kind of my take home from this study is trying to focus on calcium-rich foods, at least at a meal before the strenuous exercise, whether that's breakfast or lunch, depending upon when the practice is. And most people tend to focus on either, and I say most people, so those with a fitness mindset, maybe not sports, they may, as skill and experience increases and kind of age, part of experience, they will learn this and accommodate this. But I think most people would not consider calcium something they should really strive for in that early meal or a meal before practice. And so could be a case for milk, yogurts, dairy products, maybe supplements depending upon dietary preferences, but to have calcium be a part of the diet plan for sports and for athletes who may participate in sports with high bone stress, anyway, to alleviate potentially a stress fracture. It's to reduce the risk. It's not saying that it will completely eliminate a stress fracture or full fracture, depending upon issues, because if somebody falls, granted, a rower falling they're going to get wet. But for like cyclist runners, falling may lead to a fracture, and regardless of calcium intake. So anyway, thanks for tuning in. Feel free to like, subscribe, do all those things. And until next time, thanks for tuning in. Bye.